Hey, everybody. Welcome to today's lesson on the different forms of medications. This lesson discusses medicated inhalants like aerosols and sprays, which are classified as liquids. We will cover the physical characteristics, the mechanisms by which they deliver medication to the body, and demonstrate the correct methods for their administration. Medicated inhalants, such as aerosols or sprays, are forms of medications designed to deliver drugs directly into the lungs or the nasal passages. The primary use of these medications is to treat conditions affecting the respiratory system by delivering medication directly to the site of action, minimizing the systemic side effects. They are particularly effective for conditions such as asthma, chronic obstructive pulmonary disease, COPD, and allergic rhinitis. These medications are produced through a process that ensures the active ingredients are suspended in a propellant or solution, making them easy to inhale. For example, metered dose inhalers, MDIs, use a propellant to deliver a specific dose of medication in aerosol form. Aerosols are suspensions of fine particles of medication in a gas, which can be inhaled into the lungs. The particles are small enough to penetrate deep into the bronchial tubes, providing immediate relief from symptoms. Aerosols can be delivered either through inhalers or nebulizers. Inhalers include pressurized metered dose inhalers, MDIs, dry powder inhalers, DPIs, or soft mist inhalers, SMIs. These are all small, portable, handheld devices that can be kept on the patient. Inhalers can be used to treat conditions like asthma and COPD. A spacer may be used. This allows for more of the drug to get into the patient's airway. Nebulizers are devices that have a small plastic tube and a cup called the nebulizer that connect to a small air compressor, which pumps air. Liquid medication is put into the nebulizer, and the air compressor makes the liquid into an aerosol. The patient places the mouthpiece over their mouth and breathes through their mouth until all medicine is gone, usually within 10 to 15 minutes. Nebulizers can be used to treat conditions like asthma, COPD, cystic fibrosis, pneumonia, acute bronchitis, and respiratory syncytial virus, RSV. Sprays are typically used for delivering medication into the nasal passages. They are designed to coat the nasal mucosa and are often used for allergic rhinitis or nasal congestion. Sprays usually target the nasal passages and sinuses as opposed to the lower respiratory tract. Sprays include decongestants, steroids, antihistamines, and saline solutions. All of these provide a localized effect to the nasal passages and sinuses, reducing nasal swelling, inflammation, and clearing mucus. The effectiveness of inhalants lies in their ability to deliver medication directly to the lungs or nasal passages, allowing for rapid absorption and action. Once inhaled, the medication is absorbed through the lung tissues or nasal mucosa into the bloodstream. After absorption, the medication is distributed throughout the body via the bloodstream. However, because the medication is delivered directly to the site of action, the required dose is often lower, reducing the risk of systemic side effects. Patients with COPD are often prescribed corticosteroid inhalers, which deliver corticosteroids directly into the lungs, reducing inflammation and improving breathing without the systemic side effects associated with oral corticosteroids. If a fast-acting bronchodilator inhaler, such as albuterol, and a corticosteroid inhaler are both ordered, give the quick-acting inhaler first. Wait 1 to 3 minutes before giving the second inhaler. Let's briefly discuss the proper technique in administering medicated inhalants. The procedures for administration are covered in more detail in different lessons. For aerosols, provide these instructions to patients. 1. Shake the inhaler well. 2. Breathe out fully to empty the lungs. 3. Instruct the patient to place the mouthpiece in their mouth and close their lips around it. 4. Press down on the inhaler to release the medication as they start to breathe in slowly and deeply. 5. Have the patient hold their breath for about 10 seconds to allow the medication to settle in their lungs. 6. Repeat the dose if required, waiting about 30 seconds between doses. For sprays, provide these instructions to patients. 1. Gently blow your nose to clear any mucus. 2. Shake the bottle if instructed. 3. Instruct the patient to tilt their head slightly forward, insert the nozzle into one nostril, and press to release the spray while breathing in gently through their nose. 4. Repeat for the other nostril if required. Safety precautions specific to inhalants include monitoring patient technique, especially with inhalers. Provide feedback or additional training as needed. In all medication administration, safety precautions should include prescription verification and medication review to prevent drug-drug reactions. Monitoring for side effects or adverse reactions and implementing supports for patient compliance to their care plan is crucial for patient safety and effective treatment. If adverse reactions or noncompliance is observed, report to the responsible provider immediately. In summary, medicated inhalants such as aerosols or sprays are forms of medications designed to deliver drugs directly into the lungs or the nasal passages. Aerosols are suspensions of fine particles of medication in a gas, which can be inhaled into the lungs and include inhalers and nebulizers. Sprays are used for delivering medication into the nasal passages and are designed to coat the nasal mucosa. Sprays include decongestants, steroids, antihistamines, and saline solutions.